Hey all, this is Dr. Nate, WeDriveHealth, CEO and founder, and I'm here today with LaVarro.
Yes, I'm LaVarro. Mm-hmm. Not a CEO, but I am a patient at WeDriveHealth.
There you go. So LaVarro agreed to come on our show today as we continue to explore some amazing topics related to what we're seeing with our patients in their chair when they're sitting in our chairs. Again, many of the topics are very, very similar in terms of what or themes that we're seeing in the chair. And I'll just first start asking LaVarro, what prompted you to come to our primary care office?
Well, what prompted me to come to your office specifically, well, it was you. I met you at a meeting, like this men's circle meeting that JT puts together, and you were talking about health. You were talking about the different processes and how you handle patients in WeDriveHealth specifically, and I was like, oh, that's way different than the hospitals that I go to and the primary care person I go to that I don't like. I'm not saying I don't like the person. She's fine. Yeah. But I don't like the process, and I don't like the system of healthcare normally. Like when I go there, I feel like I'm a number. When I go there, I feel like the doctor just kind of flies in for like 5 minutes and then flies out. Yeah. I don't know. I felt like coming to you, I will feel more cared for as a person. So that's what prompted me.
Well, I appreciate you coming and seeing us in the office.
Yeah.
And then just for many out there who don't know what the office environment seems like, just explain to us what happens from the time you walk in.
So you walk in, it smells nice.
Yeah.
You walk in, it smells nice. You don't feel like you're walking into a doctor's office. You feel like you're walking into like this spot. There's a person at the front desk who's nice, and she greets you and says, what are you here for today, and blah, blah, blah. And then I'm like, yeah, I'm here for this. And so, okay, when you come into this room, and it's this other room that's all white, there's a bearskin rug on the floor, there's music playing. It's so nice. It's a real nice, comfortable environment that you wouldn't mind waiting in for a little while.
Right.
But I wasn't waiting. Like when I go to the doctor, like I'm waiting in this big, y'all been to the doctor, so you know what happens. But when I came there, I was waiting in this nice room, and it was maybe 5-10 minutes, and then I came in and was able to get some service.
There you go. I love that. Yeah. I know those waiting rooms are usually like a reservoir of like petri dishes, and people are coughing on you. You're there for like 2 to 3 hours. You get frustrated. I went to
the doctor once, and I waited for like an hour, and then they came out and said, "Oh, we have to reschedule you for another day." What? So I was there for an hour for nothing.
Yeah.
You think I rescheduled that appointment?
He said, absolutely not. Yeah. So I mean, that's pretty much why we see a lot more urgent cares popping up, because patients can't really wait, or the wait times are just astronomically long. The healthcare system, of course, we still have some gaps we're still trying to work out. But I appreciate to hear about your experience as you walk through the door. Tell me personally what's been going on in your life that really prompted you to say, hey, let me take a charge on my health.
Yeah, there's a few things. Like I'm getting older.
Older.
I just turned, I'll be 43 this year. I got married like a year ago.
Nice, congrats.
Thank you.
Yeah.
I bought a house 2 years ago. So there's a lot of life changes happening, a lot of things going on with me, and new responsibilities and such. So I feel like I needed to take care of myself. I needed to pay more attention to this health part. Like I couldn't run and just be going like I used to. So and I still want to be able to. So I figured that I need to do something to optimize my health. Like when Michael couldn't run and just dunk on people anymore. He developed that jump shot.
Yep.
So I felt it was time for me to develop a jump shot. In addition to that, a few months ago, my little brother passed away. He passed away he died in his sleep of a heart attack. And he wasn't like an unhealthy person, but you just never know what's happening on your skin. If you don't know, then you don't know.
Right.
So yeah, I just it was kind of a wake up call to everybody in my family to know that we got to take care of ourselves. So.
Yeah. I'm sorry to hear about your brother's passing, and I think this is usually what it serves as a reminder that, again, we really have to take better care of ourselves as we continue to progress through life and we go through our life changes and through our transitions. So tell me some of the things that that were important to you prior to the visit. What goals did you have as stepping into the office?
Well, there's two main things. One, I'm overweight, and two, I have high blood pressure. Okay. So I wanted to, and I hate taking medicine.
Yeah. Yeah.
With the I don't like taking Tylenol when I have a headache. I don't like it at all.
Right.
But I have to take these blood pressure pills, or I don't know what happens. Their heart explodes. I don't know, something happens.
Yeah, over that. Yeah.
So I have to take these pills. So,
sure.
And then the doctor I was talking to before said, "Well, this is life now. Like you're taking these pills for the rest of your life." And I just felt like I didn't have to take it for the first half. Why do I have to take it for this next half?
Right.
So I wanted to figure out ways to where I can get my blood pressure under control naturally, to where I can come off these pills.
Yeah.
I know part of that is is weight loss, and I know it's eating. I know there's some things that I need to do, but I would like to look at my healthcare primary care person as like the coach in my game of health life.
Yeah.
So because I know things and I know what I should do, but I was looking for a guide to guide me through what I was doing.
Yeah, and this is very important. Like this accountability coaching type person. This is the element or the art of healthcare that has gotten lost because we're just inundated with so many patients and we're just inundated with administrative burdens, right? So it is very important that you mention this, and this is what many patients have also echoed in the past, dealing with chronic conditions or something that looks like chronic conditions. In reality, as a myth buster, obviously not all patients will require lifelong therapy on these medications, right? So again, with changing lifestyle modifications and of course close monitoring and of course taking into account family history and other things, there's many ways to personalize your healthcare journey where you're not bound by a drug for the rest of your life. So that is unfortunately a misconception that many patients get, whether it's from us as primary care, we don't do a better job, or in general, just how our parents, our folks are so used to going to the doctor, they gave me a pill, I don't know why I'm taking it, but I got to take it, right? We're not in that realm or that era anymore. We're very, very educated consumers. With untreated blood pressure, there's always a concern for stroke, for silent heart attacks, other things that are very concerning. So of course, that's always very important to attack. So then there are ways that we can do bridging, right? Where we can get your blood pressure under control with medications temporarily. Then after, with lifestyle modifications every 3 months, we reevaluate. We could then decrease the dose of medication until we could safely get you off the medication. There's other things like echocardiograms, which is checking your heart valves, making sure everything looks fine. So all of these measures just are there in place to ensure that your blood pressure doesn't create any damage to other organs in the body. But obviously you can regulate this other ways, and that's what we're working on together. Tell me a little bit about this challenge that you've entered into our office. There's a special type of challenge that we're doing.
So it's a 90-day, not a weight loss challenge, 90-day fat loss challenge.
Exactly,
with men, and we have there's a grand prize. Can I say how much it is?
Yeah.
Okay, there's a $2,000 grand prize on this challenge. I think it's like $750. But anyways, there's money involved.
Yeah.
It's a good competition. It's a healthy competition because one, it's targeting everyone's health. And it's also like fun. Like we have a group chat where we're encouraging each other and saying what we're doing in a playful way. Talking mess to each other,
talking smack. I love it.
So yes, it's a fun challenge. I think we got like 30 days left. Somewhere around that 30 days left. It's exciting. It helps me not to be alone on the thing. So it's a good. I'm glad I'm part of it.
I'm so excited that you're part of it. Our guys are very, very hyped. I think we have 15 enrollees who are participating in this. We definitely have 30 more days left. Thanksgiving, be careful with that joint.
It ends like right right after Thanksgiving.
Right.
So it's gonna be a tough one. But
Yeah, don't get clapped out here in these streets with Thanksgiving. It could be a little rough, but we out here. So John Jay, shout out to John Jay. He's our myofascial stretch therapist. He does a lot of fitness work in our office. He's made it very clear. He's been instrumental in helping us develop a protocol for patients who want to improve their lifestyle, optimize their lifestyle physically, right? So we have a device that you step on, a body composition device. Do you remember anything about that device for you?
Yes. So that device, it's like a super scale to where it tells you your weight, yes, but it also tells you like the composition of your body. It tells you how much your left arm weighs, how much your right arm weighs, how much water is in this part of your body, and how much is fat and visceral fat. Like it tells you like, it's like an X-ray machine without being an X-ray. It's dope.
It is pretty fire. I mean, the goal is that we can monitor the different parts of the body composition. You got the visceral fat that you're attacking as part of this challenge. You have the muscle mass that we're hoping to continue to build as everything kind of comes down. So yeah, we're very excited about this device and what it's able to do. We're hoping that it changes the landscape of what healthcare looks like, where we don't just step you on a scale every time you come on a visit. You actually step you on a device that gives us a more comprehensive evaluation.
Because a scale tells you your weight, yes, but there's a lot of different stuff, a lot of different factors that should be factored in with health for sure.
Absolutely.
Especially in weight loss specifically.
Yeah. So I think it's very important that we remind patients that yes, we are comprised of other elements in the body that would tip the scale, so to speak. So tell me about one thing that you noticed during your actual interaction with myself, or maybe even want to name a couple that kind of stuck out and said, wow, this is a very impactful or very important type of conversation that we're engaging in.
Well, the conversation between me and you was like a long conversation. Like we talked about everything. It wasn't just about, you didn't just fly in and say, oh, so you're taking this, you're doing this, great, and then you bounce. Like we came in, we talked about my family history, we talked about my day to day and how I'm feeling and all that stuff, which is not something, sadly, it's not like a conversation I've always felt like rushed in my former primary cares. So that thing, and then even after, when the results came in, like it was the same thing. It wasn't here's an email, here's a portal that tells you everything. Right. Hope you can figure it out.
Right. Which means that Dr. Google will help you figure it out. Yeah.
Like you really like stopped and went over every line. Like this number means this number, even though this number is flashing red. It's not. Don't worry about it. Like that type of thing. But when I'm in my primary care, like my formers, they would send me this thing, and it's like these flashing red numbers, warning, and
no one's explaining
it. Right. So, I think it's the personal touch, the personal care that's that really resonates and really is like helpful. And the other thing is I felt like I left your office with a plan. Like after the results, it was okay. This is what's happening with this thing. This is what we're gonna do about this. This is what's happening with this thing. This is what we're gonna do about this. Versus. This is what happened to this thing. Like when I go to other places, when I've been to other places, they blame everything on my weight. Everything is like, well, you need to lose some weight. So if you lose some weight, all your problems are solved. And that just can't be. That just can't be.
Right.
I feel like it's they're using that as a way to say, like it's a cop out for everything that's happening in my life.
Right.
So when I came to you, I did not feel that way. I felt
good.
Cared for.
Good. And again, I mean, the thinking is I'm putting myself in your shoes. If I was in your place and I really don't understand all of this medical jargon and mumbo jumbo, what does this mean in my life? How do I practically use this in my life to apply? And, we've had patients who are very fit physically, who are very, very, their numbers look crazy on the labs, right? And it has nothing to do with just weight alone and this and that. Again, we're just these complex, holistic beings that require a little bit more. Is it our stress level? Is it the way we're sleeping? Is it the way we're eating? Is it our family genetics and is it our behavioral things? So there's just so many elements of it that, of course, impacts us as human beings. I think, or I should ask you better, rather, What do you notice? Is it helpful to have a male provider? Was that helpful for you? Did you feel like it didn't matter male, female provider? Did it matter the provider looked like you? Were there any elements of the visit that you felt influenced you in any way? Or do you feel like it was just the knowledge? Was it just the caring and the compassion?
It was the caring and compassion for sure, but it's definitely, talking to a male black doctor.
Yeah.
Which let me think. Which I've never had. I've never had.
I've never had. Think about it for a second.
I had to think about it. I don't want to exclude nobody.
Yeah.
But no, I've never had a male black, and they're young. I don't know how.
Yeah.
I think you're somewhere around my age or younger.
Yeah.
That can talk to me like regular, a regular person.
Right.
And knowing that being a black male doctor, possibly have gone through some of the same things health wise that I've gone through.
Yeah.
Really helps for sure.
Yeah.
And we can talk. It's cool. It's a more comfortable thing. I don't feel like I'm talking to a teacher. I feel like I'm talking to, somebody who just knows more about health than I do.
Right. So it's all conversational, very relaxed environment. Yeah, I get that. I appreciate that. So you've seen or have heard of some of the services that we provided at our office.
Yes.
Is there anything that you're like, oh, I want to hear more about that service and how it impacts my health overall?
The IV service, the IV thing, I think is a dope thing. I don't need the hair thing because my hairline is still
the hairline's still strong.
It's still strong.
My guy's hairline's still strong. Shout out to his barber.
But yeah, I was interested in the IV stuff because I can get the vitamins directly in me.
Yeah. So you know how like we have the traditional multivitamins that we get, whether it's from GNC or any of the other health places. First of all, what we notice about vitamins is that you need to take it daily, and you have to be very regimented for it to add up into your body, right? For it to actually make some kind of effect so that you could feel something. We are not very good at taking daily vitamins. I'm guilty of that as well. I just think it's just cumbersome. Sometimes we don't remember. Life happens. So the thinking is, why not replace it with IV vitamin infusions instead? High doses of IV vitamins that will last you for about a couple of weeks, that will prevent you from having, or at least minimize you from having to worry about, oh, did I miss my vitamin today? Did I not miss my vitamin? It gives you the same level of B complex, or actually at a higher rate of B complex, which is great for everything: hair, skin, nails, neurological function, cardiovascular function. So just pretty much all your organs get some benefit from B complex vitamins. And then B12 specifically gives you a lot of energy. A lot of us are lacking energy for whatever reasons. We have the vegetarians and vegans who lack B12 because of their food. They're not able to get it in their meats. And then just in general, we just lack B12. So having that on board is very, very helpful for energy. Vitamin D, very, very big player in our metabolism, in our energy. We tend to suffer from it, especially people of color. We tend to run lower than normal vitamin D levels. There's so much research that shows if we optimize the vitamin D levels, we optimize so much. Brain health, metabolism, our bone health, our bone structures, and all of that leads to longer, healthier lives. So these are some of the things that we're able to replenish without you having to worry about taking a daily vitamin. And then there's these cool new things like glutathione. It's a liver detoxification. It's an antioxidant. It's something that you can't get very particularly in a vitamin that we're noticing that starts to decrease it's an enzyme that starts to decrease in our bodies when we start to age. It helps with keeping our belly fat down. It makes sure that we don't store very unhealthy fats in places they shouldn't be. So glutathione has been a huge player in many of our IV vitamin compounds. Of course, vitamin C is important. And then very, very important vitamin for men particularly. Men, listen up. Zinc. So zinc has been shown to increase your testosterone levels, which many of us are thriving to do, right? We're trying to keep our testosterone higher, vitality higher, our stamina to really be able to perform everywhere, whether it's in the bedroom, whether it's just in life daily. And we're noticing that zinc levels, once they increase, your testosterone levels also tends to increase. So these are all of these key players of things that we can give you in an IV infusion. And you're like, whoa, I feel revitalized, I feel refreshed.
And all this comes in one IV visit. Like
one IV visit. Yeah. We just lump everything in a bag. Once IV stick, you're good to go.
Nice.
Yeah.
How long does that process? How long am I in the IV thing? Like, how long does this take?
Sure. So I mean, usually the actual IV itself runs for about 45 minutes.
Okay.
And then during that time, of course, there's a lot of education about what you're getting. We like to say we're curating a cocktail. We want to say that we're bartenders of the healthcare world, you know?
Nice.
So we're putting your cocktail together. So maybe if your B12 level's too high, you don't need this particular B12. If your vitamin D level happens to be normal, maybe you don't need the vitamin D. So we tend to hold certain things. We kind of replace it with other things. So just based on your labs, your family history, your medical history, we're able to comprise a good cocktail that works for you. So it's very personalized, customized for you.
Nice.
Yeah.
And what is the actual? They're sticking a needle in me.
Yes.
And then what am I
And
reading?
then what are you doing?
What am I doing?
So remember that beautiful plush carpet room that
I
you
do
saw
remember
in the
that.
all white? So
Yep.
that room is called the remedy room, and we like to call it the remedy because it's very relaxing, and it's you're letting your body feel this remedy or this medication, but in a clean way. So we're giving you some clean vitamins, nutrients, and everything. You recline in a chair. We place an IV in you. It's minimally painful. The IV drip runs for 45 minutes. The fluids, you don't feel anything with the fluids. Maybe a little coolness that runs through the IV portal or the IV port, but otherwise it's very comfortable. Many of our patients usually use this opportunity to sleep. They relax. The music is very serene. The goal is that this is your time to kind of take care of yourself. So a way of self-care, right? But you're being very intentional about it. So we are helping you achieve that by reclining, giving you blankets. It's just the works.
Sounds kind of fly.
Yeah. It kind of sounds fly, right? A little spa-like type of experience just to get your vitamins. You know?
How often should you or could you do this?
So that's usually the very common question that we get from patients. We usually say we like to let the vitamins build up for a certain period of time before we start to taper down how often you get it. So usually we recommend in the beginning once a week for about 4 weeks, then once every 2 weeks for about 4 weeks, and then usually after that we kind of really taper it to maybe once every 2 months. So usually after a certain period of time, the vitamins will circulate and last much longer in the body, and usually doesn't require as much as in terms of frequency to come into the office.
Yeah. Sign me up.
Yeah. And then there's other exciting things too that we've been doing with the IV infusions, just a new add-on service, something called NAD. It helps with cognitive impairment or cognitive focus. It prevents cognitive impairment. So what we're trying to do is there's a specific type of amino acid in the brain that starts to decrease after the age of 35. So with that, we give boosts of it, and it makes you feel like you're on Adderall. But it's like a clean version of Adderall. Pretty much you have a tremendous amount of mental clarity, alertness, concentration, focus. And it usually lasts for a couple of weeks. It's actually really, really tremendous. There's a lot of new data about it saying that actually it improves long-term quality metrics of it improves your chances of not getting Alzheimer's, so that this is really, really new and exciting data. So this also comes as an IV drip. The thing with this as an IV drip, it runs a very, very slow rate because it's like a powerful punch to the brain. So you usually feel a little woozy, could feel a little off for the moment, and then usually when the drip stops, you feel completely fine. So what we tend to do is we give it as a shot or an injection instead. So it's a quick NAD shot. You sit there for 5 minutes with a glass of water. You feel very good. You go about your day. So it's a really good way.
This is all like above board, all like health vitamins and stuff.
Yes, this is some high level vitamins that are like not usually seen. NAD is not well absorbed in the oral or in the GI flora or in the GI gut. So what we tend to find is that it's better when we put it in an IV because you get 100% of the availability of the NAD. So it actually goes to where it needs to go. When you take it orally, only 50% of that NAD needs to go where it needs to go, and the other part is just excreted very quickly in your stools, your urine. So yeah, IVs or injection is like the best way to go.
That's fly.
Yeah.
Do you have anything that can give me Spider-Man powers? Like
Peptides. Peptide therapy is close enough to that.
Okay.
So peptide therapy is also an amino acid that we're trying to replenish, and it's a growth hormone factor that we don't need as an adult because we've already grown. Everything has grown already, and what it does is it really gives you good energy. Right? It's one of the patients described it as cocaine, and this is what it felt like at that time. Obviously, it's not cocaine. It has no ill effects like cocaine, but just the effect of, whoa, I feel like Superman and I'm ready to attack my day. So that is taken at home. It's patients get it as a vial with protocoled instructions of how to take it. And then patients just take it at home. It's a small, tiny injection. They go to sleep. Helps you get tremendous quality of sleep. You wake up and you feel like, yo, I'm ready to attack the world. So that's peptide therapy.
That's funny because I said jokingly,
to
give me Spider-Man. He was like, yeah, I got this.
Yeah, we got this. We got this too. Whatever you need, we got. You know what I mean? So yeah, these are all exciting things that are not traditional medicine that we've been used to or accustomed to, but we're doing a lot more research that there's these other more clean, holistic ways of trying to achieve what we need to achieve.
Dope.
Yeah.
Well, I'm sold.
There you go. So LaVarro is going to keep on coming back to the practice.
Yes.
And these are amazing questions that most of our listeners, I'm sure, have had in some capacity. Many of our patients tend to continue to have these questions. I hope that everyone has found this to be extremely helpful.
Well, before you, it sounds like you got to close. Before you go, tell us about, because I know you have different weight loss protocols, programs and stuff. I particularly was not interested in the Ozempics and the whatevers of the world. But still talk about those because it's just me who's not interested.
Yeah.
And then also tell us about alternatives to that
Absolutely.
that are helpful.
Absolutely. So everyone, we're probably at this point very familiar with these once-a-week injectable medications. They're called GLP-1 receptor agonists, and they fall into the family of the semaglutide versus the tirzepatide.
We don't know what you're talking about.
Yes,
Dr. Nate.
fancy terminologies just for two different classes of medications that you inject once a week into your belly, and it helps you have a decreased appetite. It gets you fuller much faster, so your portion size are less, and overall you consume less calories. The medication is actually very smart in helping you also cut out the food noise, which a lot of patients say that they get. So patients who love to snack late at night while they're watching Netflix or something to that effect, usually they don't have that urge to eat and snack as much anymore. Patients tend to lose about 2 to 3 pounds of weight per week. It sounds amazing. It's great. It has, potential side effects that always is a discussion, usually mild GI stuff, but overall it tends to work. Now, for patients who definitely say, while this is a great option, this is not for me, for whatever reasons that might be. We also discuss many other things, right? First of all, we find out that intermittent fasting tends to work out well. So intermittent fasting usually means that when you wake up in the morning, the first thing you do, you actually don't eat. You wait. You give your body some time to modulate its sugar, its glucose levels without you doing anything. Let it do it on its own without any food. And by 11 a.m. or 12 noon, you start your first meal. Your last meal shouldn't exceed 7 p.m. The thinking is that your last meal should be at least 3 hours before you go to sleep, so that way the food digests naturally and you're not holding on to that excess fat. Walking after eating has been tremendous in terms of keeping the belly fat down. So after your meals, walking around the park, walking a pet that you have at home, that usually is a good opportunity to do so. And then there's the stuff in the IV infusions, like the glutathione. While we were mentioning the liver detoxification, at a higher dose, it actually helps slim down the belly. So the stool content starts to change. All the fat comes out with the stool content with the glutathione. So these are all the different ways that it can help. Peptide therapy as well. Peptide therapy has been shown to increase lean muscle mass because you're achieving good sleep and then good sleep-wake cycles. And lastly, you're able to use the bathroom much better. So these are great ways to improve all of those things.
I want all that.
You want all of it? Let's see. It's like, sign me up.
Yes.
All right, I got you. So LaVarro will be back in the office. We're gonna make sure he's in there. He's good to go. His health will continue to optimize. Thank you so much for sharing your story and sharing your experience with us at WeDriveHealth and sharing it with everyone out there. And again, the goal is that we are here to optimize health. At the end of the day, the goal is to prevent many of the ailments. We can do it ourselves. Our bodies were designed to do it. And we are just helping you curate and change the behaviors to really optimize where you need to go with your health.
Thank you, Dr. Nate. Appreciate you for having me on.
Thank you so much for being on here. Have a good day, guys.